Today topic of discussion SLE, systemic lupus erythematosis. It is an autoimmune disease that is our immune attack our cell. It comes under immune mediate inflammatory disease. So basically what is mean by autoimmune disease? Autoimmunity is a state in which the body's immune system fail to differentiate between self and non-self and react by formation of autoantibodies against one's own tissue antigen. In other words, there is loss of tolerance to one's own tissue. Autoimmunity is the opposite of immune tolerance. Simply our body attack itself. Autoimmune diseases are two types. It can be local or it can be systemic. Local means organ specific, localized. Systemic means whole body affected. So first one is local or organ specific. What are the diseases? We have so many diseases. What are the diseases? Myasthenia gravis, Graves disease, then Hashimoto's thyroiditis, then good posture syndrome, type 1 diabetic mellitus, then multiple sclerosis. These are going to be local. These are some autoimmune disease that affect local organ. That means this Graves disease increase thyroid level. Then this Hashimoto, this one decreased thyroid level. This good posture syndrome mainly affected kidney and lungs, but predominantly it affected kidney. Coming to systemic, where we have that SLE. It is a systemic autoimmune disease where the autoimmunity because of antigen antibody complex. So it is mediated by antibodies or antigen antibody complex. These can be caused damages. Here what want to focus? Here we are focusing SLE. Then some other disease, polyarthritis nodosa, rheumatic arthritis, scleroderma, and inflammatory bowel diseases. These are the example of systemic. Here we are focusing SLE. Introduction of SLE. SLE is a classical example of systemic autoimmune disease or collagen disease. It is systemic erythematosis. Okay, what is systemic lupus erythematosis? So systemic means it is system, then erythematosis means erythema or it causes some redness. Lupus, it look like wolf. Okay, it look like wolf. Eat away skin like a wolf. Then there are two types. Previously it believed this one will affected skin only, so eat away skin like a wolf. There are two types. One is discoid form. It can be local. Cheeks are affected. Okay, this discoid form is the local one. Cheeks are affected. Second one is systemic or disseminated form. Later on it disseminated. SLE etiology. Why somebody get this SLE? Because of genetic factors, mainly family, then HLA, MHC genes mutation, some problem in complement system. So these are the genetic factors. Because of family, monozygotic twins, HLA and MHC gene and a problem in complement system. Second one is immunological factors, some problems in B lymphocytes, T lymphocytes, and cytokines. Then environmental factor, UV light can be causes. Then some drugs induced this SLE. What are the drugs? Hydralazine for reducing hypertension we will give, okay, increasing that decreasing blood pressure. Then proconamide, then that one used for anti arrhythmic. Then dipencilamine, dipencilamine, it is a silating agent. Okay, this one is the silating agent for CU. Pencilamine, dipencilamine, so it is a silating agent of copper. Then estrogens can induce SLE. So what are the etiology? Because of genetic factors, then immunological factor, environmental factor, drugs and estrogens. Pathogenesis, interaction between susceptibility gene, environmental factor, lot of immune response, and it form various antibodies. So it form antibodies against nucleus, it form antibody against the cytoplasm. DNA also make antibodies. So many type of antibody synthesis. Basically antibody fight against the foreign antigen. Here antibody affected our own system. So autoantibody against the nuclear and cytoplasmic compound or demonstrate that plasma by immunofluorescence test. So basically that will be the laboratory diagnosis to determine that antibody in that plasma. So first one is ANA, that is anti-nuclear antibodies. Anti-nuclear antibodies. These antibodies common against the nuclear antigen. It include DNA. RNA is not our genetic material, so DNA 95%, 98% we can demonstrate this anti-nuclear antibodies. 98% we can demonstrate. Then we have antibody to double standard DNA. Here specifically attach the double standard DNA. It has been presented in high titer value. Then anti-Smith antibodies. It appear against the Smith antigens. The Smith antigens is a part of ribonucleoprotein. You see, it is a part of ribonucleoprotein. The ribonucleoprotein against this antibody formation will happen. Then we have lot of other antibodies like anti ribonucleoprotein, that is anti-RNP. Then this ANA, anti-nuclear antibody, can be seen in many other autoimmune diseases also. Then anti-RNA is seen in the Sjogren's syndrome. Then anti-histone antibodies, anti-phospholipid antibodies, APLA antibodies, then anti-ribosomal B antibodies, antibodies against the protein in that ribosome. So anti-ribosomal P antibodies means antibody against the protein in ribosome. This one will affect central nervous system. Then this SLE um, antibody against all this person. Okay, these are the antibodies. Then type 2 hypersensitivity and type 3 hypersensitivity. SLE in because of type 2 and 3 hypersensitivity. Type 2 means within us. Okay, antibody comes, otherwise it is presented within us, otherwise it comes from outside during blood transfusion. Then type 3 antigen antibody complex, immune complex deposited various part of our body, so it causes problem. It mainly deposited in blood vessels, kidney. So mainly that reason only SLE person having kidney problem also. Moving to clinical features, more than 11 criteria are presented. More than 4 criteria the person have means he affected from SLE. Who recommended that more than 4 ACR criteria? American College of Rheumatology. So what are the diseases it will causes? Malar rash, discoid rash all over the body. Malar rash means butterfly rash on face. Then blood disorders, all the blood level decreasing, WBC also, white blood cell also, platelet also, everything lost here. Then renal disease, then anti-nuclear antibodies, then immunological disorders, then neurological disorder, then serositis, then oral ulcer, arthritis, photosensitivity. Totally 11. 4 or more than 4 means we considered that patient have SLE. Some other disorder also is there: fever, weight loss, malaria, renal phenomenon, ocular and peripheral neuropathy. Next, morphology of major lesion in SLE. Basically, renal lesion, kidney affect a lot. Blood vessels are affected, skin is affected, heart also affected. A renal lesion is called as lupus nephritis. This one class 1 to class 6 is there. So many classes, minimal to advanced. So what are the things? Minimal disease lupus nephritis, mesangial proliferative lupus nephritis, focal lupus nephritis, diffuse lupus nephritis, membranous lupus nephritis, advanced sclerotic nephritic lupus nephritis. In small blood vessels, it causes lesion, cutaneous lesions, butterfly area on nose, cheek. Then cardia lesion. This one is Liebman-Sachs endocarditis. What is Liebman-Sachs endocarditis? This tricuspid valve and mitral valve. Okay, here what will happen? This is heart. In this one, mitral and this tricuspid valve vegetation are present. Okay, here vegetations are present. Fibrinoid material, necrotic debris, inflammatory cell, hematoxylin bodies. The connective tissue of endocardium and myocardium shows focal inflammation. So here it shows that focal inflammation. Fibrinoid materials, necrotic debris, inflammatory cell, hematoxylin bodies are presented. Next, laboratory diagnosis, we are using blood sample and biopsy. In this one, LE bodies or hematoxylin bodies. We can find out what is LE bodies. Here, see here that nucleus. Okay, nucleus normally inside presented. That nucleus fused to that periphery. Nucleus fused to periphery. This one is the nucleus. So this one is LE cell. This cell, when that nucleus fused to this here periphery. This one name is called as LE cells. What is occupying this space? So here nucleus come here means here what are the things occupying? Basically whatever neutrophil help, that one is occupying this phase. Basically it is the phagocytosis. So here basically what happened here, WBC or monocytes whatever, so it is going to eat injured cell or ANA coated, that denatured nucleus. Okay, all the things. So here what the things occupying? Anti-nuclear antibodies or injured cells. It that nucleus is fused to that periphery. So here injured cells are ANA anti-nuclear antibodies coated cells inside occupying. So this cell name is called as LE cell. So LE bodies basically refer to neutrophil, and if monocytes eats a interact lymphocytes, and it is called as tart cell. So monocytes is eat a intact lymphocytes. It is called as tart cells. So what are the other diagnostic method? Other diagnosis method: anti-nuclear antibodies, anti-double stranded DNA antibodies, various different type of antibodies we detected. No, all the antibodies detected by immunofluorescent technique. Then treatment purpose using immunosuppressive drugs, immunomodulator, then corticosteroid drugs is recommended.